Hi, my name is Markel-Crozier. I'm the Director of Elder Care Coordination with Bratton Law Firm, and I'm here today to talk about compassion fatigue. Compassion fatigue is most commonly found among healthcare professionals, and this is something that we are experiencing at a very high volume during this pandemic. So I want to talk about some signs and symptoms of compassion fatigue, most importantly, so that we can not only look at ourselves and see if it's something that maybe we're experiencing and going through, but also to be able to talk to our coworkers, our loved ones, and other caregivers and professionals, and really see if maybe they're experiencing compassion fatigue and just don't understand that that's what is going on, and then we can try and help them with how we get through this. So one of the first things that is a sign of compassion fatigue is really not knowing how to understand and feeling burdened by the suffering of others. You know, it's very difficult as we're watching people get sick with COVID, people we know and love, but we're also watching them die, and we're watching them die alone. That's something that definitely feels like a burden on a lot of us that are working in the healthcare field, that there's nothing more we can do for them or for their family members. Also the burden of people that are at home that can't get out and do the things that they love, or can't see their loved ones, or are losing out on the things that they want to be doing or should be doing, like graduations and weddings and things like that, and really feeling that burden is carried on our shoulders. Definitely feeling that they're blaming others for the suffering. So there's a lot of people, especially if you watch on social media, there's a lot of the blame game, people pointing fingers at who caused the suffering or why is it being caused. But that's definitely another sign of compassion fatigue. Isolating ourselves is a sign. Many of us are isolating because we, aren't able to get our hair done, or we don't know how we feel, or we're scared. And so we're isolating ourselves even further than just what we should be practicing as the social distancing and quarantining. Maybe we're not answering the phone. Maybe we're not texting. Maybe we're not, reaching out to people like we normally would be reaching out to people. There's definitely loss of pleasure in life. So not only are we not allowed to do the things that we want to be doing that causes us happiness, but some of the things that maybe we were doing before that we can still do, it's not causing, giving us any pleasure. And so because of that, we're kind of becoming more depressed and don't really know what to do any longer. Difficulty concentrating. I know for me, I have to have a plan. I have to have an agenda every day, or else I have trouble concentrating and getting focused and moving throughout my day. So a lot of us are really struggling with that concentration and keeping on task. And that definitely is another sign of compassion fatigue. Insomnia and frequent nightmares are another sign. Insomnia, maybe we're flipping through our phone right before bed, and so the things that we're seeing on there are keeping us up at night. Maybe it's because it's a time that we're supposed to be turning off our brain and kind of relaxing and going to bed, and we're not able to do that. And then the excessive nightmares, because again, we're scared. We don't know what's going to happen. We don't know what's going to happen next, and we don't know what's real, and is it going to affect me or my family? Physical and mental fatigue, just because again, constantly we're thinking, we're worried, and again, we're not able to go to the gym and go for our hikes and those types of things. So it's causing that physical and mental fatigue. Definitely feeling powerless, having no control over what we're able to do and not able to do anymore, and then having hopelessness attached to that, bottling up our emotions, and then from that overeating, or having difficulty with excessive drinking and doing drugs. There's been a rise in alcoholism and drug abuse during this time, and that's another sign of compassion fatigue. And the other thing is lack of self-care. So from compassion fatigue and from all of the stress that's going on in the world right now, we're not practicing our own self-care, which may be things like taking a shower, eating right, and we need to make sure that we're watching out and being healthy, watching out for each other and watching out for ourselves. So I hope that we can kind of look at all of these signs and symptoms, see if there are things that are affecting ourselves, and then also reach out to people that we know and love and see if it's things that's maybe affecting them. We're going to have some more videos talking about what we do if we do see these signs and symptoms, and also how to address the self-care and things that we can do to make ourselves feel better. So I hope this helps. I hope that this kind of raises awareness on compassion fatigue for all of you. You don't just have to be in the healthcare profession to experience that. And again, if there's anything that we can do to help at Bratton Law, please feel free to reach out. Thanks so much and have a good day. Stay safe, everyone.